Social media. Does it bring people closer together? Or does it cause anxiety, isolation, and depression? As social media continues to grow, this question has gained more relevance. Online social media has caused profound changes in the way people communicate, especially since we have been in the middle of a pandemic over the last year and a half. During this time, social media has allowed people to stay connected in ways they never had before. Even though we have seen the positive sides of social media, there are downsides to it as well. Several studies have indicated that prolonged use of social media sites, such as Facebook, Twitter, and Instagram, may be related to signs and symptoms of depression. In addition, some of these studies indicated that certain social media activity might be linked to low self-esteem, especially in children and adolescents. Other studies have presented the opposite effect in terms of positive impact on social media and self-esteem. As we have seen in the last year and a half, people needed social media to stay connected. However, there are many potential reasons why a social media user may tend to become depressed, as there are numerous factors that may lead to an already depressed individual to start to use or increase their use of social media. Studies have indicated that the internet use in general significantly affects social relationships and participation in community life. Research found that increased time spent online is related to a decline in communication with family members, as well as the reduction of the internet user's social circle, which may further lead to increased feelings of depression and loneliness. Although social media allows an individual to interact with many people, these interactions are often shallow and cannot replace everyday face-to-face communication. In 2013, Krause et al. Published a study on the relationship between Facebook and subjective well-being in young adults. The design of the research was based on text messaging the participants 5 times per day for 2 weeks to evaluate their mood, feelings of loneliness, social interaction, and social Facebook use. The results indicated that the user's subjective perception of well-being and life satisfaction may be undermined. It is understood that any decline of this sort may increase depressive signs and symptoms. One of the reasons why time spent on social media may be associated with depressive symptoms is the fact that the computer-mediated communication may lead to altered, often wrong, impressions. This may lead to incorrect conclusions regarding physical appearance, education level, intelligence, moral integrity, as well as many characteristics of online friends. Recently, Chow and Edge published an article about the potential impact of using Facebook on students' perception of others' lives. Perceiving others as happier and more successful does not necessarily result in depression. However, in individuals who already have certain depressive predispositions, as well as other psychiatric conditions, this may further negatively impact mental health. It seems that when social media and the internet in general are used to strengthen and maintain social ties, particularly within family members and close friends, the results show social support has beneficial effects on mental health, as we have seen during this pandemic. On the other hand, extensive use of social media outside these circles might weaken existing close family, friend interactions, and increase feelings of loneliness and depression. Low self-esteem is associated with numerous mental illnesses, including depression, eating disorders, and addiction. Constant self-evaluation daily competition, and comparing one's own achievements with those of other, incorrectly perceiving physical, emotional, social characters of others, feelings of jealousy, and narcissistic behavior. These are all factors that may negatively influence self-esteem. Addiction to online social media, as well as the internet in general, are recently and insufficiently investigated phenomena, frequently discussed and sometimes disputed in psychiatric literature. A sudden cessation of online social media, for example, lack of internet connection, may result in some chronic users cause signs and symptoms that at least primarily resemble the ones seen during drug and alcohol and nicotine withdrawal. Social media addiction presents a new issue in psychiatric research, and as with other social media related disorders, it can be expected that future research regarding the potential effects of online social media on mental health is going to be faced with numerous difficulties. The existence of a correlation does not necessarily equate causality. Facebook and self-esteem may be related in terms of Facebook usage, causing lower self-esteem, but it may also mean that people with low self-esteem use Facebook more often. In other words, it is difficult and sometimes impossible to conclude which variation is the cause and which one is the effect. It should be noted that most of the research done so far on social media and mental health has been done on healthy populations. No research of this sort has been conducted on psychiatric patients. It may well be possible that people with personality disorders, which quite frequently and oftenly go undiagnosed, spend more time on social media compared to the general population, because computer-mediated communication enables them to be socially more successful. These individuals, if included in a research study, will influence the results of self-esteem, depression, and addiction. In conclusion, social media has caused significant changes in the way people communicate and interact. It is unclear, however, whether some of these changes affect normal aspects of human behavior and cause psychiatric disorders. In the future, additional research will be needed to identify and describe the potential relationship between the use of social media and various mental health issues. Thank you.